Regenerative medicine clinics and the people running them are not all the same. Some are led by highly trained physicians with years of medical school, residency, fellowship, and real-world experience. Others, they took a weekend course, injected a cadaver or two, and now call themselves experts. This is a buyer beware industry. If you don't know what to look for, you could end up with expensive, ineffective, or even dangerous procedures. Let's break down who should and who should not be doing regenerative medicine so you can make the right choice before anyone sticks a needle in you. Regenerative medicine has so much potential. I love this field. I'm passionate about it, and I'm even more passionate about making sure that people understand that there are a lot of shady things going on out there. There's a lot of scam cell clinics, and there's a lot of people that are doing things that really should not be doing. So I've broken this down into 3 simple questions that you can ask. And if a person is really legit, if they love what they're doing, they're qualified, and they have no problems with answering the questions, this shouldn't be confrontational. This shouldn't be something that they squirm at or go, oh my God, why did you ask me such a thing? They should be so excited to tell you about it because it really helps inform you as the patient, and it helps develop that relationship that is so important because regenerative medicine is not pixie dust. It's not magic. It's not anything that just works overnight. It entails a partnership with somebody. So if you know the physician or practitioner that is doing your procedure, you understand where they're coming from, you understand their training, it's going to be a great start to the relationship. So number 1, what's your specialized training and experience, especially concerning the spine? I have so much respect for the spine, and I have so little tolerance for people who are doing spine procedures who have no right doing them. After all, the spine, and sometimes the targets, are 1 millimeter outside the spinal cord. And these targets are to be respected. You don't just go to anybody to have the traditional epidural steroid injection or radiofrequency ablation to the nerves or spinal cord stimulator placed or neurosurgery to remove pieces of bone or ream out the holes so that there's more room for the nerve roots. So this is the real deal. The people that are doing spine should be spine trained. I'm talking to the level of neurosurgeons who've done regenerative training, orthopedic spine surgeons, physical medicine and rehab, fellowship trained, anesthesiology, pain, fellowship trained, people who've done thousands, if not tens of thousands of injections into the spine, not a cadaver course, not a few dozen or even a couple hundred. Because here's the deal. When you are working with the spine, you are working with some very delicate and high-end real estate tissues that if there is a complication, you want to know that the person is able to then manage the complications. Let's say you get an infection into the disc. Does that person who put the needle into the disc have the ability, admission privileges, to take you to the hospital? And the colleagues, the surgeons, neurosurgeons, orthopedic spine surgeons, who can then take care of something such as an abscess or an infection within the epidural space. Who are you letting put the needle near your spine? What kind of training do they have? This is a non-negotiable for me. So it's something that you absolutely need to ask if you're looking at a spine procedure. So number 2, how do you track and report patient outcomes for all these procedures we're recommending? One great question is, say you have had a consultation and a procedure is being recommended. You can say, okay, great, thank you. In a person like me, with a scenario like mine, what kind of outcomes have you noted? And what kind of experience do you have treating people like me? And that lets the physician that you're going to say, looking at the database, I have collected the data for X number of years, and I can say that a person of your age, your sex, your overall health, with your comorbid conditions such as diabetes, also high blood pressure or obesity, or all these other things that play a factor, that I can say that in the first 12 months, the vast majority, 80%, have shown an X% reduction in pain and increased function of Y%, right? Something that really can allow you as the patient to say, okay, I get that. That's going to manage my expectations. Maybe I have some higher risk things that make me not as likely to have the kind of outcomes than if I were a 22-year-old who just had a brand new knee injury and we're trying to inject my meniscus for a brand new tear. It puts you in a different perspective and allows you to have, again, that nice conversation with the person and decide if this is the right procedure for you. The right person in the regenerative process is going to tailor the treatment to you specifically. They're going to take into account your entire medical history, your surgical history, your medications, your allergies, the things that you've done before, and more importantly, your goals. If your goal is to return to running marathons and you've got stage 4, grade 4 osteoarthritis of your knee, that's a different conversation than if you plan to play on the playground with and be able to take care of your grandkids with the same condition. So they're going to be different things, and you need somebody who can have that nice, honest, transparent conversation with you to know what the likelihood is that you're going to have the kind of outcomes that you desire. The third question is, what additional training in interventional orthobiologics have you had, and how do you maintain that expertise? Because although somebody may have done a pain management or pain medicine fellowship like I did and injected tens of thousands of targets within the spine, for example, you count each joint, if you count each space or each patient, it's not the same. You're not using the same injectate, right? You're not using the same philosophy. The old traditional stuff was you put a steroid into an area and you might put it into one joint. You might put it into the epidural space and you see 3 months later, how did you benefit? It's totally different. Regenerative orthobiologics is a whole different subspecialty. So it's fantastic that you have the background, as I did, in interventional pain, but you can achieve other things. You can achieve a competency, for example, from the American Board of Interventional Pain Physicians. It is a board exam. It is a competency. It is something that then allows you to say, I understand the risks, I understand the data, I understand the science behind all of this, and I am applying it appropriately. So, attending things such as the Interventional Orthobiologics Foundation, IOF, or the Orthobiologic Institute, TOBI, or the American Association of Orthopedic Medicine, the Biologics Association. Those are 4 big ones that people who are the leaders in orthobiologics attend. They attend annual conferences. They get the latest and greatest. For example, we didn't know until a couple of years ago, maybe 2 years ago, and now it's mainstream that you need 10 billion platelets to get an effective dose in something such as knee osteoarthritis. You don't get 10 billion platelets from a couple test tubes. You don't get it from a 10 cc draw, a 15 cc draw, a 20 cc draw. We're talking about a minimum of 60, if not 120 cc's. There's so many people out there who are doing this that are not even drawing enough blood. You cannot get the dose required. We know there's a dose response curve. When you hit 10 billion platelets, you get the best outcomes. So finding somebody that has done special training in specifically interventional orthobiologics and who maintains that expertise. So not questions 1, 2, and 3. Number 1, what's your specialized training and experience, particularly involving the spine? Number 2, how do you track outcomes? How do you report these patient outcomes for the procedures you recommend, and how does that apply to me as a patient specifically for what you recommend? Number 3, what is your specific training in regenerative orthobiologics above and beyond what your residency or fellowship training is? And how do you maintain your credentials? By asking these questions, you can better assess the person's qualifications. You can better assess how you're likely to respond to these treatments. And you're just going to develop a better rapport with the person who you're trusting yourself and your health to. Thank you.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.